everyone, to our NCAA Social Series, episode 42. I'm Andy Katz. Pleased to be joined by Dr. Brian Hainline, the NCAA Chief Medical Officer, Dr. Jay Butler, who is the Deputy Director for Infectious Diseases at the CDC, and Commander Erin Sauber-Schatz, who is at the CDC as well and in charge of the Community Interventions and Critical Populations Task Force. She takes the lead on that. Let me first start with you, Dr. Sauber-Schatz, and basically providing for our audience sort of a general viewpoint of that long title. What does it mean in terms of how your job is done practically?
Sure. So when CDC stands up an emergency response, we stand up different task forces and groups within a response to help really dive into specific topics. So the task force that I'm in charge of, we focus in on the mitigation measures. So we've put together guidance of where you live, work, learn, and play, and what you can do to help slow the spread of COVID-19 and keep yourself, your friends, and your family safe. So this includes wearing a mask, washing your hands, watching your distance, and of course, cleaning and disinfection as well.
And Dr. Butler, during this pandemic, what has been your role?
So I actually served as the incident manager for a period of 2 months during May and June. And actually before that was in a consultative role. And actually that's where I first became acquainted with some of the work with NCAA as we began to address how do we strike the right balance between maintaining normal societal functions, which includes competitive sports, and keeping everyone as safe as possible. And I continue on in that role to be able to support all of the responders, including Dr. Sauber-Schatz and her team on the task force.
So Dr. Hainline, and first of all, I know I'm thrilled that we have representatives from the CDC, two esteemed colleagues here from the CDC, because we've referenced the CDC so often. So now we get to actually hear from them. So from the NCAA perspective, how have you worked with the CDC?
Well, it's been a wonderful collaboration. I actually was supposed to visit the CDC in March, so we had begun our discussions way back when, and ever since then, you know, we've had very regular discussions, especially around the time when we're coming out with our resocialization documents, Erin and Jay and really a group of CDC experts. They're very gracious with their time, and I ask them a lot of questions about where we may be going, and they provide me the CDC references and really the CDC guidance on it. And all of our documents, we really try to lock in very, very closely with where the CDC is. You know, and another great collaboration has been that NCAA member schools have been providing some data to the CDC. There was a great study that was published January 8th that was on quarantine data. And so that sort of collaboration is going on as well. So in essence, for our resocialization of collegiate sport, the CDC has just been a hugely important partner in terms of providing guidance to us.
And we're going to dive deeper into all those topics here during this episode. And Dr. Sauber-Schatz, you know, one thing that has come up throughout the course of the pandemic for our purposes since last March was how sort of the marching orders from the CDC apply to sports, especially a population in college athletics that is testing regularly, sometimes daily in certain conferences, or at a minimum 3 times a week versus the general public. So how did the CDC take that balance of what was put out there for this population versus the general public?
Sure. So it's almost unbelievable to think that just a year ago, up to the day, just about, that's when our first case of COVID-19 was diagnosed in the United States. Since then, we've had 24.3 million cases and over 400,000 deaths. So we really, in the last year, have learned something new about COVID-19 every single day. So with that, our guidance has been updated with the best available science and evidence that we have as we've gotten more data, as we've done more analyses, as we've learned, for instance, who's most at risk for severe illness from COVID-19. So as the CDC, we're a non-regulatory agency, so we use science and data to share what we know, share our experiences and that data to decision makers to inform data-driven decision making. So for sports, we put forward the evidence and the data and what we knew about COVID-19, for instance, it being a respiratory illness, and thinking about sports and that you breathe heavier, you breathe deeper, and that can actually project, therefore, COVID-19 respiratory droplets further. We worked, for example, with NCAA to help think through their guidance of how to keep athletes safe in a situation of playing sports where we know that there's going to be heavier breathing. So that's just an example of how we've collaborated and how we've really learned a lot in the last year. There's still more to learn, including around sports, but we provide the evidence, and then in some of the leagues and NCAA have put in things such as testing strategies and masking and distancing to allow sports to continue as safe as possible.
You know, Dr. Butler, I just got to say that one thing, and I'm the only doctor, non-doctor, I should say, in this grouping here. So, you know, obviously I don't have the knowledge that the three of you do, but it drives me crazy that the general public sometimes does not grasp that things evolve and things can change. And you're all just grappling with this virus, as you said, just a year ago. And so Dr. Butler, if you could address just the way in terms of guidance and ways in which you must tackle this have changed from last March to almost a year later.
Yeah, so Andy, it's been a real steep learning curve. As Dr. Sauber-Schatz has already described, this was a disease that was just getting on our radar roughly a year ago. And so we had to put forward prevention guidelines based on the information that we had available at the time. One of the things that we knew very early on is that the virus that causes COVID-19 is very closely related to the SARS coronavirus. However, we learned over the first few months that it behaves very differently. Unlike the SARS virus, it can be transmitted by people who have no symptoms at all, and the peak of infectivity for those who develop symptoms is actually at onset. For SARS, there was very little, if any, evidence of transmission from people without symptoms, and the peak of infectivity was at the peak of symptoms. So that was very challenging. So some of the early approaches, such as really focusing on symptom screening, while still important, were not enough to be able to control spread of this virus. And we estimate that more than half of all transmissions actually occur from people without symptoms. So as we look at the ways that we keep people safe and as much as possible being able to carry on their lives as close to normal as possible, we really have to look at some of these issues such as wearing masks. It's not just a matter of wearing one if you are at risk or if you have symptoms, but it's really something that we all have to do. Same goes for being distanced from other people. As an example, Dr. Sauber-Schatz and I are together at CDC, but we're actually in separate studios so that we could take off our masks and not be sharing airspace. So those are the types of examples of where we apply what we've learned to be able to keep everyone as safe as possible. And then also environmental controls. The evidence is that if we're indoors, we're at higher risk than if we're outdoors. Being able to have good ventilation likely reduces the risk of infection. And these are all things that we've learned that really apply to a sporting environment as well as a working environment such as what we're in right now.
And Dr. Hainline, if you can, you know, I just want to revisit the way it evolved also for college athletics, in that when all of this started in the summer in terms of athletes being allowed to be back on campus, everything was outside. Weight rooms were put outside. And obviously as the weather changed, you couldn't do that in a lot of places around this country. And so everyone sort of adapted in different ways. Maybe it was phases of student athletes going into the weight room or the gym or what have you. But how did that evolve in terms of the direction that as the virus changed, as the months went on, and as the weather changed, you also had to adapt in terms of the guidelines from around the country?
Yeah, that's right, Andy. And that's why, I mean, we put out over 10 documents, 7 resocialization documents, I remember very early on when we were classifying sport, the transmission risk of sport, we were very, very concerned about, transmission surface to surface. Our very first document, we cautioned about sharing a football or football, sharing a basketball. We were very worried about indoor gymnastics and so forth. And then as we came to understand the mode of transmission better with the CDC guidance, and it became clearer that, well, yeah, surfaces are important, but the respiratory spread is much more important. But we were really quite concerned initially about football. We really didn't know, and so we had strict guidance in place for football. And then, as we came to understand what happened on a football field and football practice, and also as the CDC really was coming to understand the difference between indoors and outdoors, it shifted even further. And so when we moved sports indoors and we looked at sports like basketball and water polo, and we understood that close proximity in an indoor environment was going to be even more challenging than in an outdoor environment. So as the knowledge base has grown, and so have our resocialization documents shifted, and so now the maximum amount of testing we do is for those high transmission risk sports that are played indoors.
So, Dr. Hainline raises a good point, Dr. Sauber-Schatz, that how things have evolved. I mean, when this started, for example, people weren't sharing a tennis ball. They might be playing on, opposite sides, obviously, of the tennis court, but they may have their own balls with their own initials. That has sort of faded out of the public space. Obviously, everyone's sharing a basketball right now because games are going on. Same with football. We just completed the college football season at the Division I level. You could go down the line. Where did it change where the actual object that you play with, could be shared without fear of transmission?
Yeah, I think really just as we learned more about the virus, about SARS-CoV-2, which is the virus that causes COVID-19, and there were really the whole world was working on figuring out all the ins and outs of this virus, and we still are. We still don't know what the long-term effects of having COVID-19 are. We updated guidance such as sharing equipment, realizing that wasn't one of the main risk factors. That being said, we still recommend washing your hands if you're sharing equipment with other people. And so again, it's just really, as we're learning more, adjusting our guidelines, making sure that people can be as safe as possible. As Dr. Butler talked about, one of the things we really learned about was that ventilation, or outdoor versus indoor, which in the sports world, it really is sport dependent on how that affects your risk of getting COVID-19 from possible teammates, coaches, or other support staff.
And Andy, if I could just add, I think it's an example of where the laboratory experiences and experiments are very important, but they don't always answer all of the questions. So ongoing public health investigation, the epidemiological studies are really critical to be able to answer the questions about whether or not what's been observed in the laboratory really plays out in real life. And as Dr. Sauber-Schatz has described, one of the things that we learned was that sharing sports equipment, at least in terms of things like passing a basketball from one person to another, is not nearly as high a risk as sharing more the type of equipment that you may wear, or that might be more likely to be contaminated with respiratory secretions.
How did you both balance the different attitudes around the country, and that certain places of the country, and we're actually seeing this now during the college basketball season. For example, one school in the Northeast are making their players play with a mask on. The majority obviously are not. Some high schools are making their players play with masks on. Majority are not. Some places allow fans, some do not. How do you deal with that different interpretations of the guidelines that have been put forth by the CDC?
Well, Andy, maybe I could start with that. First of all, some of those differences may be entirely appropriate because we do recommend that those decisions be based on the local disease activity. As the risk of disease locally begins to decline, it may be okay to be able to liberalize the mitigation strategies that would impact a sporting venue. The other challenge, of course, is that there's, remains some skepticism about what the pandemic really is, what the virus is. And that's always the challenge in working with a natural disaster, if you will, that's caused by a microbiological agent. It's not like a hurricane or an earthquake where we all experience the same thing. So there's an individual, almost psychological effect of learning to understand that this is a real threat, but it may not be the same all across the country. So oftentimes we'll see data, there's like a little scoreboard always on the corner of some of the news networks showing the number of cases in the past 24 hours. Well, in some parts of the country, that's a very real number because the rates are extremely high. In other areas, it may not be so high. And I think sometimes because people don't experience that same impact at that time in their own community, they may be a little more skeptical. And that's where we have to be patient, but also as consistent as possible in our messaging so that people at the local level, as well as in their personal lives, can make the best decisions possible.
And I also would add that a lot of this is a personal decision too, where some game officials have chosen to mask up while they're officiating. It's not mandated when they're running up and down, but some have chosen to do so. So Dr. Hainline, a couple things obviously also have evolved, and that is the contact tracing and the quarantine. If you can walk us through, and then I want to get the reaction from our two guests from the CDC here on how things changed, initial 14 days versus, there could be times when it is 7 or is it 10, whether you're positive or if you're just someone who had an exposure.
Yeah, so importantly, and even in our last resocialization document, we make it clear the CDC still recommends 14 days of quarantine, but then they give a provision whereby there may be consideration for 10-day quarantine if there are no symptoms, or 7-day quarantine if you test negative on day 7. So we put that out there in our document, but made it clear that this was a decision not to be made by the member school, but by the local public health authority. They ultimately will have authority over whether the quarantine is going to be 7, 10, or 14 days. But some of that, decision making was aided, I think, in part by the NCAA 20-member schools sent really intense quarantine data to the CDC in a de-identified manner, and they analyzed it. And so, but there were other important lessons learned from that. And I think in the document that they published, 12% of athletes that had to go into quarantine had to do so because of a possible exposure in sport. But 88% were for social reasons, either going out or going to a party, living in a dormitory, things like that. So that has shifted as we've learned more about it, but there's still, it's not a black and white issue that someone can get out of quarantine 10 days, 7 days. It still really depends on the local circumstances.
Dr. Sauber-Schatz?
Yeah, I think exactly that. The 14-day is still the recommendation. On our website, we talk about the data that support the 10-day or the 7-day, but it is up to the local health department to make the decision of how many days of quarantine are required for their locality.
And Dr. Butler, how would you define a close contact?
So the definition of a close contact has been being within 6 feet of someone for more than 15 minutes. Now, those are not hard and fast rules that, if you're 5.5 feet away, you're at high risk, and if you're 6.5 feet away, you're at no risk of all. These are basically guidelines that can help decide who is at higher risk versus those who may be at lower risk. We will always be updating those guidelines as more information becomes available, and as the science evolves and we learn more about this virus. As we are talking about quarantine, that's a great example of where we've been able to get more data to look at what is the frequency of distribution of periods of time after a discrete exposure before someone is infected or develops symptoms. And that's how we've been able to develop some guidelines for shorter periods of quarantine, which hopefully will be more practical and acceptable to people to be able to conform to.
You know, and I want to just follow up on that one point in a second, but what if the two people are masked, you know, and within that 6 feet, and they got the 15 minutes, but they're both wearing masks during that contact?
Well, masks definitely reduce the risk of spread. And we are still evaluating how that can be incorporated into the decision about whether or not a significant exposure occurred. And there's some work that we've actually done with the National Football League that they have been able to study this using some tracking devices to be able to determine how close some of the players have been to one another. And as they began to see some transmission among players, we worked with them to develop a higher level of containment, which included factoring in the use of masks in defining what a close contact is. And these are areas where we're continuing to learn. And I think it's an exciting area because it's another part of how the learning process translates into how we get life back more like closer to normal in how we adjust to living with this pandemic and this virus.
So Dr. Sauber-Schatz, you know, there obviously is quarantine fatigue. And we've seen this with college athletes that have had, you know, multiple times where they've had to go back into quarantine, you know, for contact tracing purposes. I mean, some teams, it's been 3+ weeks cumulative. What has the data shown since the pandemic was known in terms of, you know, when someone still could be contagious or contract the virus beyond that 5 to 7 day period of a contact?
It's fairly small, Andy. So I think the difference between the 10 day and the 14 days is only roughly 5%. Right. Dr. Butler can confirm that. But it's a small percentage, but there's still that risk that's there, which is why we recommend the 14 days as the gold standard. But understanding that that might not always be feasible in certain situations, again, it's up to the local public health department to determine what level of quarantine that they have implemented for their area. I did want to jump back on one point that often will get misinterpreted. For close contact, it's a cumulative total of 15 minutes. Yes. So we've often seen schools or even sports leagues say, well, if you're only together for 5 minutes 10 times, then you should be good because you were only together for 5 minutes. But it's actually adding all of those exposures up for a total of 15 minutes being a close contact. So if you were a close contact less than 6 feet by someone for 5 minutes 3 times, that equals 15 minutes. So just wanted to add that point of clarification because that's something we've seen misinterpreted.
Yes, the clock does not reset when you step outside of that 6 foot zone.
I want to address testing here momentarily as we get closer to wrapping up, but Dr. Hainline, I want to bring you back because I did mention the sort of quarantine fatigue, and I've had countless coaches and players that I've talked to literally almost daily, and they all want to keep playing. To a person, they all want to keep playing, and some have opted out, and that's fine. And no one's going to be judged if they decide to opt out regardless of sport. But there's no question, there is mental fatigue when they have to go back into quarantine. What have you heard on your end in terms of the mental health aspect of when student athletes have had to go back into quarantine and have had to deal with it multiple times during this year?
Well, we've heard a few things, Andy, and we've actually been studying that as well. You know, we mentioned even a few months ago that mental health symptoms have increased considerably in COVID, especially depression and anxiety. But I think what's been worrying us more recently is this sense of fatigue, like, you know, you just can't keep on like this. You know, we saw that there were many athletes that said, you know, we'd rather not play in a postseason contest, and part of that was just from the fatigue as well. So it's an issue, you know, because as an athlete, you're always gearing up, you're ready to go out, you're ready to do your high level competition, You know, if you become injured, that's one thing, but when it's something that's out of your control, that makes it more challenging. But on the other hand, you look at athletes' behavior, and I think that they understand that if they aren't on guard 24/7, they're going to be at risk of developing COVID. So we actually have seen that the student athletes' behavior has consistently been improving because they know this isn't just about what happens in athletics. They have to be masked at all times, and they have to avoid situations, especially close encounters or being around people who are not wearing masks. So you're seeing two kinds of shifting dynamics, the fatigue on the one hand, but the better behavior on the other.
You know, and I'm just curious if either doctor feels comfortable commenting on that it's one thing, obviously, to have regulations and guidelines, and then there's the practical side of that fatigue of going back into quarantine if, unfortunately, you have multiple contacts in a row, maybe to no fault of your own. Dr. Butler?
Oh, I'm sorry, Andy. I wasn't sure who that was directed to. why don't you do that over again?
No, pick it up. We can edit it.
Okay. So actually, could you repeat the question? Because I got a little lost there.
So Dr. Butler and Dr. Sauber-Schatz, you know, there's the practical side and there's obviously the guideline side, which is, you know, it is safer to have a longer quarantine. We get that, we know that. But then there's the practical side of the fatigue, especially of young people who have had to go back into isolation, sometimes by no fault of their own. You know, they just happen to unfortunately be near someone who has COVID. So how do you handle that, Dr. Butler?
Yeah, so Andy, that's an excellent point because athletes love the game. The higher the level of competition, the more there's going to be a strong drive to be able to compete, to be able to train, practice, and do your very best at the sport that you love. So, and also, we're all tired of the pandemic. We're all tired of quarantine and the social isolation. So these are very real issues. And it's part of the reason in sport, sometimes there's a extra role for testing to be able to monitor for infection that might be transmitted through people without symptoms. And when resources are available, some teams have been able to do that testing on a regular basis to be able to reduce the risk of transmission and to be able to isolate those who are infected even before they have any symptoms, to reduce that risk of spread, which then also reduces the likelihood that others would have to go into quarantine after an exposure.
Commander?
Yeah, Andy, I think I was a college athlete, so I understand the rigor and the training schedule that goes into being a student athlete. And I think one thing that we've all seen, as Dr. Butler said, is we're all tired of this new way of life and having to adjust the activities and the things that we do and what we love. I know I'm still I still train, I still get out there. And one thing I've done just to help with how much time I've spent at home and the hours in front of the computer is adjust my schedule so that I'm doing exercises at home or in a safe place where I can run outside. Sometimes that still requires running with a mask. If you're in quarantine, the rules are a little different, but there's been such a boom of online fitness classes and things that you can do to still stay active, still stay strong, and still cross-train for your sport. And I think that overall wellness and taking care of yourself can help boost your morale and your wellness and your mental state, even if you are quarantined in your apartment or in your dorm room. So those are things that CDC has recommended all along. With the pandemic is taking care of yourself, being physically active, checking in with each other. I think that's something else that teammates can do is rely on each other to check in. If you've got some teammates that are quarantined or perhaps within the athletic program, find ways to connect, keep people motivated, keep people knowing that we're all looking to have people back when it's safe to do so.
So I want to go around the group here on testing because the major issue going forward with the championships that'll be happening in March and April, and then obviously we may be hopefully in a different place when we get to the spring, but let's just deal with March and April, And that is, I'll start with you, Dr. Butler and Dr. Sauber-Schatz, and then I want Dr. Hainline to jump in here, which is, if you have been positive and you are outside of the 90-day window, so let's say hypothetically you were COVID positive in September, October, there's a real concern with a lot of these, college coaches right now about, they haven't had to be tested because they're within the 90 days. Now they're going to move past the 90 days. Why should they get tested again and run the risk of maybe being positive, but not infectious or contagious, I should say, but yet being positive because they already had the virus back in September, October?
Yeah, so Andy, it's a great question. It's one of those areas where we continue to learn more. First of all, one of the challenges with a positive test is, while it doesn't prove that you are infectious, it also does not prove that you are not. So a positive test means isolation, no matter when it's obtained. The issue of reinfection is an area where we continue to learn. As we look at other coronaviruses, and these are the coronaviruses that cause more common cold type symptoms, we know that people are reinfected every few years. We don't know yet for SARS coronavirus 2 how often reinfection may occur. Again, it's a virus that's only been infecting the human species for a little over a year now. So we continue to learn. And we are continuing to analyze the data to determine what is the optimal period to say it's very, very unlikely that this is a reinfection. But the tricky thing about this virus, it throws us a lot of curveballs, and recently it's actually given us a fastball to the head with the emergence of some of the variant viruses that may behave differently. So, the issue of what we say today about 90 days and the risk of reinfection is something to monitor closely, because we are monitoring closely the emergence of these new variants, which may actually increase the risk of reinfection. And I know that's very discouraging to all of us, but it's a reason for ongoing concern. So if I could mix in another sports analogy, it's too early to throw in the towel on this pandemic. It's not over yet.
Dr. Sauber-Schatz?
Nothing to add. Dr. Butler answered that perfectly.
Well, so Dr. Hainline, we've talked about this. The concern that, athletes who have tested positive earlier than the 90 days and now will have to be retested beyond the 90 days. What will be, or what are the rules right now for championships if you have contracted the virus and your 90-day clock is up?
Well, if your 90-day clock is up, then you're back in the testing pool. And of course, we go back if you're within 90 days and you have COVID-like symptoms, and an infectious disease specialist or infectious control officer cannot explain these symptoms by anything but COVID, we would retest the athlete then as well. But after 90 days, you're back in the pool and there's no questions asked. If we look at data from the professional sports, and they have a lot of data on this, and we do as well, it's unusual to test positive after that 90 days. People talk about having the remnants of the virus that are there, and that leads to a positive test. We've seen it in some immunocompromised individuals, but it is really unusual. And so we're sticking to that. So, we've developed guidelines for our championships, for example, that are coming up in the spring, and that's the rule of engagement.
And lastly here, I want to get back to the vaccines. Obviously, we hope more people get vaccinated, but in the short term, the reality is that before the winter championships, and I'm talking about that March, early April period, the population that would get vaccinated would probably be anyone who's compromised, or potentially coaches who are 65 and older, or personnel who fit that population. So, Dr. Butler, if those people have been vaccinated by the time we get to a championship, what would be the CDC recommendation for whether or not vaccinated people, fully vaccinated, I guess, and you tell me otherwise, should continue to be tested?
So that's a great question. And those are guidelines that are still in development and may actually be different than what we would say today by the time March and April roll around. At this point in time, my recommendation would be to still do the testing as we continue to evaluate the impact of potential variant viruses, as well as the protection by vaccine against asymptomatic infection. The trials that evaluated the 2 mRNA vaccines that are currently in use did not assess the impact of the vaccine for preventing infection without symptoms. They were highly efficacious for preventing illness caused by SARS coronavirus 2, and particularly severe illness. So until we have a little more of that information, my recommendation would be to continue to test, and we'll have more formal recommendations available as more information becomes available.
Dr. Sauber-Schatz, I want to give you the last word here, just an overall view on where we are and, hopefully where we will be as we progress here. You're a former athlete. As the athletes look forward to the championships and the end of this winter and as we head into the spring.
Yeah, we're all cautiously optimistic that we are going to be getting the COVID-19 pandemic under control. With the vaccine, there is a light at the end of the tunnel. The tunnel is long, but we are encouraging everyone to get the vaccine as soon as they are able to. My parents just got their first dose last week, so it really encouraged me and made me feel better that they're that one step closer to having that protection. We all want to get back to the way of life as it was in 2019, but I think it's also an opportunity when you lose a game, you learn from it. And so I think we all have to reflect on the pandemic and see what we learned through this experience and how we can be better, how we can build, how we can take that forward, and just be a stronger nation, stronger neighbors, and stronger community.
And lastly, Dr. Hainline, we've talked about this before, but I want you to sort of put an exclamation point on this, and that is that as frustrating and disappointing as it is when a positive pops and a team has to go on pause, how much does that show, though, that the system is working because it's being caught and hopefully it's preventing any kind of wide outbreak?
Well, great question, Andy. I mean, when we are testing so regularly in athletics, and if you look at football and basketball data, more than 80% of the scheduled contests have gone on, and this is with very, very regular testing. And so, we often hear about the canceled events, but not the ones that are going on, and they've been going on safely. And at the same time, we've developed a cardiac registry. It's the largest COVID cardiac registry in sport. We're gaining enormous information from that, some of which will be published in a couple of weeks. So we feel good overall about where we've been, and in some ways one could say that the way that sport has re-socialized can even be considered a model for society. We have not taken any testing supplies away from individuals, and we're really advocating strongly for the best behavior and for prudent testing, and maybe that's a way that can serve as a metaphor for how other segments of society can open up successfully as well, while we're waiting for the vaccine.
Wow, so I appreciate all three of you, of course. I think this has been incredibly educational, informational, and hopefully, as Dr. Sauber-Schatz said, it's a long tunnel, but there's light that we can see, hopefully, at the end. Dr. Hainline, Dr. Butler, Commander Sauber-Schatz, appreciate all of your time. And as always, you can go to ncaa.org/social series, where we have all our social series archived. I'm Andy Katz for the NCAA. We'll talk again next week. Stay safe, everyone.